Good afternoon, good evening. My name is Lisa Ackerman. I'm the Executive Director of TACA. I am so excited to always have my friend Dr. Walter Zahorodny with me today. We always like to talk about the Autism Developmental Disability Monitoring Network, and we've just had a new release of the autism prevalence. And there's so much misinformation, specifically in the prevalence. And these interviews are really to dig into the data of the complexity of the report and to let viewers and folks understand what's really behind all of the data and the numbers. Our goal is to interview expert resources and to share facts from these reports. And we want our community to truly understand the rate and the prevalence increase. It's a pleasure to introduce Dr. Zahorodny. He's joining us today. He's the principal investigator of the New Jersey CDC study and associate professor of research. His background, working in the pediatric department of Rutgers University, New Jersey Autism Medical School. Walter established and maintained an autism surveillance system of evaluating environmental non-genetic risk factors for autism and developing novel approaches to screen autism and assess. Their recent publications, preliminary evaluation of a brief autism screener for young children, which presents evidence in support of psychological developmental questionnaire. In the past, Walter has studied neonatal withdrawal and designed a reliable tool for evaluating severity of withdrawal in the neonatal withdrawal inventory. The questions we ask could take hours to respond, but we're going to do the best with the time we have today. And I like to always mention this is my fourth interview with Dr. Zahorodny, and I am so grateful for his work. And we're going to talk about the 1 in 31 numbers that came out in April 2025. So let's get started, Walter. Thank you for joining us.
It's a pleasure to join you, Lisa. Thank you for inviting me.
How long has the Autism Developmental Disability Monitoring Network, or let's just say ADAM for short, has been in place, and why was it created?
Yeah, we've been doing autism surveillance since 2001. We came into existence originally because high autism prevalence estimates from Brick Township, New Jersey, led the CDC to want to form a multi-state surveillance network, which would look at the prevalence of autism and the characteristics of children with autism. And so we've been with this important project, this important system now for 24 years. It's gone by in a flash, I would say. And it's been fascinating for me personally to be part of an endeavor which involves researchers across the United States using a very comprehensive and valid population-based system to look at autism. It's unprecedented, and I would say among the efforts to understand how many individuals have autism and how is autism expressed, this may be the most important system that's ongoing.
So grateful for your work. If I don't say it enough, thank you again for you and your team. So now let's talk about the findings from April 2025. Adam, what's a summary of what we found?
Yes, so my summary is that, again, autism prevalence higher than expected, higher than our last estimate 2 years ago. 1 in 31 across the ADAM network states and 1 in 29 with autism in New Jersey. This is the 12th time that we've looked at autism using a consistent system. And I would venture to say that no one expected us to always show higher than expected levels of autism, but that's what it is. Also, I would say very important among the many findings described in this report is the fact that autism prevalence is not equally distributed. More recently, in comparison to when we started the ADAM network, autism now is overrepresented among children from underserved communities and from minority communities. That's different from how it was when we started. When we started, the rate was equivalent across race and ethnicity, but then with time, we saw that white children and children from high income communities were more likely to be identified with autism than their peers. And sometime after birth year 2012, this demographic distribution shifted. And now we're finding not that autism is equally prevalent among groups, but that some groups, like minority children or children from low income communities, are more likely to have autism than their affluent or white peers. This is a true shift. It's been recorded across the Atom network. It's been recorded across the data we have from the IDEA, the federal education system, and it's consistent with data from the California Developmental Disability System. Uh, this phenomenon or this demographic distribution is surprising because while we may have expected rates to equalize across groups, we never expected that being part of a group as it is now would be more associated with greater likelihood of autism and autism diagnosis. For some reason, we don't really understand. Maybe this is a clue toward understanding the reasons for autism's escalation. Who gets it is changing. And it's not only that minority children are more likely to have autism, they're also more likely to have autism, which is associated with intellectual disability and with severe impairment due to autism. So there's a qualitatively greater burden of these of autism plus intellectual disability on these populations, which we would want to understand. Unfortunately, while the prevalence might be greater and the burden of autism might be greater on these communities, we're still behind in terms of early identification of autism in these underserved groups and timeliness of diagnosis.
Add in timeliness to get services going. Seems
Yes,
like there's one wait list after another for families. That's what we're witnessing.
right. In New Jersey as well, and fewer practitioners. The people who are now our diagnostic leaders in the field of developmental disability, child neurology, child psychiatry. Some portion of these experts are going to be retiring, and they're not being replaced by new professionals. So while the rate of autism increases, the number of people who are going to be diagnosing and treating these individuals is decreasing.
Not good news across all lines, I would say.
Looks like bad news to me. Everyone wants to keep going, and everybody that I know who's involved in this is putting maximum time into it. But there's really not enough time when autism prevalence is in the 3 to 5% range.
Our goal is to keep ringing the bell and having these conversations so we have a sense of urgency to address the need. So thank you. Well, there's more to we have more questions, so we'll keep going. The Diagnostic and Statistic Manual of Mental Disorders, 5th edition, or my favorite, DSM for short, was DSM-5 diagnostic criteria 100% in this Atom release?
Yeah, we use the DSM-5 criteria. We've been
Okay,
using it. We've been using the DSM-5 criteria exclusively for the last 3 cycles. And
great.
before that, we went through a period where we were doing autism estimation by both DSM-4 and DSM-5 criteria. So we understood the subtle differences between these two different diagnostic systems. Everything now is reported by DSM-5 standards, And everything according to the coming from the Atom Network since the 2018 report is really based on already diagnosed cases. This is something maybe some of your uh, members and some of your followers understand. From 2000 to 2016, the Atom Network was using an independent, expert guided system of analysis, which allowed us to find not only the children who were diagnosed with autism through age 8, but to also identify those children who satisfied the criteria for autism, but who hadn't yet been diagnosed. And in this report and in the two preceding ones, we're not using the more comprehensive approach. We're using an approach which is based on diagnosis of record. So, as strange as it may seem, from my perspective, the estimates that are posted were revealed about a month ago are still underestimates of true prevalence. These are not the maximum rates. These are the rates that are based on who was diagnosed through age 8. Even more surprising, in my opinion, is the fact, we're also surveying autism among preschoolers. The report not only goes into how many have autism at age 8, but we also reveal the number of children who are diagnosed with autism by age 4. And that number, for some reason, yet to be understood, that number or that estimate is now higher than the rate of autism during what we thought of as the peak period.
Right.
That 4-year-old estimate is a look into the future. And unfortunately, what we see when we look into the future is that it's very likely that the next estimates will be even higher than the current one reported.
Wow, that's sobering. So in your opinion, using DSM-5, is it more inclusive or exclusive over the previous diagnostic DSM-4?
Yeah, we looked at this very carefully in anticipation of this shift from one approach, one definition to the other. And clearly, the DSM-5 criteria are slightly more demanding or slightly more restrictive than the DSM-4 estimates. When we compared them, that is, the estimates that would be gotten by using one or the other, we found that the DSM-5 based estimate was in the range of 20% lower than the DSM-4 estimate. So we're not finding more cases because the definition is more liberal or more permissive. We're actually finding more cases in spite of the fact that the definition of autism based on the DSM is more restrictive.
It's so important. We'll keep sharing that factoid. We're not seeing the quirky kids being diagnosed. It's more kids impacted with more
Yes.
disability.
Whether you're looking at we whether you're looking at the cohort we identified in 2000 or the cohort we identified in this most recent report, the group reflected in the 2022 data, these are all children who have an important and uh, a true impairment in their ability to learn and to function independently. These are children who are receiving special education services, clinical interventions, uh, all kinds of strategies are being tried to help these kids learn better, more efficiently, interact more uh, productively and creatively with their environment. We were never established to identify the individuals who have autistic features or autistic characteristics.
Right.
All of the people that we're identifying and following, all the children we're identifying and following meet met very strict criteria and are impaired in their everyday functions. If we were to project based on traits or autistic characteristics without disability, the rate would be so much higher.
It's an important distinction. Thank you. And again, sobering. one of the questions that tends to invoke a lot of response since the press conference on April 17th was, why is profound autism so controversial? And let's dive into what this report shared about profound autism.
Well, this report didn't share anything about autism prevalence among the children who would have what we would consider profound impairment. There was an excellent report from Adam investigators 2 or 3 years ago, which summarized what we learned from the first 16 years of autism monitoring. And that was, according to that report, the first author was Michelle Hughes. Approximately 27% of all children identified by population-based surveillance had what we would call profound autism or profound impairment due to autism.
Mhm.
According to the definition, which was arrived by experts and published in Lancet, these are children who had intellectual ability in the very impaired range with IQ findings, intellectual quotient findings of 50 or below, and or individuals who are nonverbal or minimally verbal. These are the most severely impaired individuals. IQ below 70 is already indicative of a lot of difficulty learning, profound difficulty learning new information. So when you focus on children with IQ below 50 and children who cannot communicate with more than with 2 or 3 words, you're indeed finding the children, the individuals who need the most help and and are the most challenging to work with. I was surprised that the rate of 27% was as high as it was. Uh, and the network had originally planned to provide information in this current report, in the 2022 report, about the individuals who were identified with profound autism. Uh, we didn't report that. It seems like there was already too much information in this update report. And before it went to the MMWR editor, our finding about profound autism was deleted or removed. I'm not saying that this was censored or that there was uh, a wish to conceal that information, but I would have preferred that it would have been made public because I don't know what makes something controversial or not. Everything about autism, in my opinion, seems to become controversial.
Yeah,
But
agreed.
we did find in our 2022 report that the rate of profound autism was about 25%.
Okay.
And that's not meaningfully different, in my opinion, than
Okay.
saying it's 27% in the years from 2000 to 2016.
No, no, thank you for diving in on that topic. We don't hold back, no punches. And we talked briefly before we hit the record button. There is a group of individuals doing look at motor disability or motor disorder and people with autism, especially in the profound category. And it's just not physical motor skills, it's oral motor skills. And there's an idea of maybe that should be included in the next DSM 5 or 6 as it graduates. What are your thoughts on that?
Um, I would like to learn more and know more about the expression of motor delays or motor deficits in autism. From my perspective, as one of the people who's reviewed thousands of records of children with autism, I obviously understand that it is very commonly a feature of the individual with autism and one which requires and responds to physical therapy and occupational therapy. These are important parts of the intervention process. Uh, I would like to know whether motor delays or motor deficits are associated with either with intellectual disability or with severity of autism. This might lead us to understand possibly subtypes or subgroups of individuals with autism. And it would also serve to underline the fact that autism is a neurodevelopmental disorder. Deficits in motor control, motor facility are signs of a neurologic impairment. This is not something irrelevant, but rather this is something key to understanding something that's an organic disability.
My opinion, maybe having that as a subcategory, we could do more to better serve the individual.
It would be a lot easier also to document and to count instances or individuals who have motor delay or motor deficits. This is not so easy to misinterpret as level of severity or perception of impairment, which is important, but really hard to standardize and hard to count. Motor delays and motor deficits can be quantified, and people in physical therapy and occupational therapy can be very careful in specifying the extent to which there are limitations and what can be done about that.
Something to hopefully it gets mentioned and brought up and we maybe start looking at it. That's all. Thank you for addressing that. So in the recent Adam 1 and 31, did you break out the autism levels 1, 2, and 3? And do we understand how many are in each group?
Yeah, we never looked at that. I know that DSM-5 criteria call on the diagnostician to provide an estimate of severity or impairment on 3 levels. We we find that that information is often not provided, or if it is provided, that it's often contradictory across reports. In a way, this could make sense because based on the individual's status, one day they could be acting in a way which leads one to think that they're more or less impaired. One view may not be enough to get to this in a valid way. And so in a way, I understand, or I suspect I understand why clinicians are not providing that information. And when it is provided, I'm doubtful that it's always reliable and correct. There may be other factors which lead a clinician to specify mild or moderate or severe impairment. Um, but the framers of DSM-5 obviously thought that this would be a very important dimension. And while I share that conceptually, I don't think in reality that the data are there for us to have confidence in in the information about these levels. And so I think the Atom Network didn't report that. We never analyzed it even on a state by state level. It probably would be worth on an experimental basis to see what's there because we have data about that. But I would be careful to have a lot of confidence in 1 year's data based on factors that stand against um, achieving valid estimates to begin with.
Interesting. Thank you. And I know this question comes up a lot and you're probably really tired of answering it, but it's so important. Why do you think folks in the media and friends chalk it off as a 17% increase over one survey in 2 years, going from 1 in 36 to 1 in 31? Why do you think people fall back to it's better diagnostics or broadening the autism criteria?
If you say it enough times, people believe it. And if you say it about 20 times, half the population or more believes it. Uh, in the Atom report itself, uh, the authors acknowledge that better awareness is possible and that it may be affecting the estimates, but nowhere does it say that this is a primary factor in increasing autism. And I'm certain that no one uh, is saying that better awareness is the primary driver of higher rates of autism. When you find something, you want to either explain it or to hope or at least to provide some possible interpretations of what your findings mean. We don't really understand what's driving autism rates higher, and so it's difficult to say with confidence what that means. And when you can't say with confidence what something means, you fall back on hypotheses and possibilities of better awareness, better recognition, acceptance of autism. All these factors, that is, the better awareness factors, are likely to be true, but for a small proportion of the increase, not for a 300, 400, or 500% increase over a 20-year period. Um, Better awareness in this context would mean ascertainment bias, that you're making a mistake in your estimate or potentially making a mistake based on miscalculation. In my opinion, that would discredit the whole premise of doing population-based surveillance. Um, and I would also hasten to add better awareness is a function of increasing prevalence. If doctors are now seeing 2 or 3 times the number of children with autism, or schools, teachers, and special educators are seeing 2 to 3 times the number of children impaired by autism, they're going to become more expert and more refined in their case finding and their
Right.
counseling. So, better awareness, I would say maybe that's just in part an artifact of higher autism prevalence. If not, let somebody show me the data that shows that better awareness is affecting the diagnosis of autism. People call on and name potential factors of better awareness, like uh, the recommendation from the Academy of Pediatrics that children at 18 and 24 months be screened for autism with a specific test or tool. Where's the data that shows that people are using autism screening effectively and that the screening is leading to more diagnosis? I haven't seen any evidence to that effect. In fact, we're in the process of collecting information that shows the opposite, that in fact that uh, very little has changed based on recommendations from the Academy of Pediatrics in terms of what's really happening in the clinical world.
And to kind of go on to that next level of understanding who is being diagnosed, we talked in a previous interview, it was between 5 to 10% of all of Adam was perhaps identifying individuals that would have qualified for the Asperger's diagnosis or autism level 1, having lower needs. Are you seeing still the same percentages in this report?
We don't have the data to compare these different levels in individuals, so I can't say that mildly impaired is exceeding others with autism. But when you look at autism plus intellectual disability, which is the opposite of what you're
Right.
focusing on, you find that this group has grown. It's not decreased, rather, in the last 4 or 5 cycles, it's increased. So I'm primarily interested or primarily concerned with understanding the individuals who have autism and co-occurring conditions or problems, and I don't see that proportion decreasing. Uh, IQ below 70 has increased in the autistic population that has been identified by the network, and also the number of children with borderline IQ, that is between 70 and 84. That's also either stayed the same or inched forward. So I don't see any positive news, though I would love to report positive news. if we were identifying higher rates based on subtly affected individuals, that would be reflected in other metrics that we're using, but that's not the case.
You for clarifying that. Do you think we have diagnostic clarity or do we need more clarity in our tools?
Yeah, so I think our tools are the main tools for autism diagnosis is the experience and the skill of diagnosticians. Since autism doesn't have biological markers or assays which confirm it or disconfirm it, the diagnosis depends on the skills and experience of the doctors who are evaluating and serving these children. This is where I would like to see the greatest emphasis. I don't see a change in the training or education of students in medical school, and I have yet to see much of a shift in the specialty training of developmental pediatricians or pediatric neurologists or child psychologists. That's where I would like to focus because ultimately that's where the diagnoses and the understanding and the communication of what the strengths and weaknesses are. The tests for the autism gold diagnostic standard tests, like the ADOS or the ADI, these are labor intensive. They
Hmm.
require special training. Uh, they're time consuming. And in the world of clinical practice, when more and more children are being seen and the diagnosis is necessary, we don't find that those tests are really making a big difference in New Jersey. In other states, the picture is different. And one of the things that your readers or your followers can look at in the current Adam Network report is the extent to which these old gold standard autism tests are being used. It varies tremendously from state to state, and it's probably the difference is based on the availability of professionals to diagnose. The more skilled, the greater the number of skilled diagnosticians, the less likelihood there is of wide use of these tests. In states where they have fewer professional diagnosticians, they fall back on using the autism diagnostic tests primarily through the school system. This is a quicker way to get to the fact that the child has autism without a diagnostician. You can provide it through a master's level social worker, physical therapist, or speech pathologist to administer one of these tests, and according to the scoring procedures to determine whether the kid meets the criteria for autism. But that's second best approach when you're not able to get the child to a diagnostician.
Thank you. So in your, I ask this every time and I hate asking you, but it's important to ask. Should the public be alarmed with these increases in these prevalence reports?
If the public can be alarmed, I wish they would show signs of concern. I don't want anybody to run around panicking, but without honest recognition of the facts. We're missing many opportunities to investigate what's driving the rate of autism forward. We're missing many opportunities to understand why there's a demographic shift in autism and why children from low income and minority communities are now being more likely to be diagnosed with autism. I think if we had true concern, we would be in a position to uh, support and create um, better studies looking at the environmental risk factors or triggers for autism or the interaction between gene and environment factors related to autism. As long as we think there's no problem, no urgency, where's the incentive to spend money, time, and energy to investigate something that doesn't need to be investigated? I personally thought that the threshold for concern was at 2%. When our group first found autism rates as high as 2%, I thought that was shocking and that possibly nobody would believe us. But contrary, it seems like everybody accepts these facts at face value, but provides the wrong interpretation. The wrong interpretation is that we're now perceiving things in a more uh, comprehensive or appropriate way, not that the rate of autism has increased.
Be alarmed, public. All right.
I don't know. Can the public be alarmed? Why not at 3%? Why not at, so in California, the rate of autism among 4-year-olds is higher than 5%. That mean then the distribution of autism favors boys with autism by a factor of about 3 to 1. So why isn't anyone alarmed if 8 or 9% of boys in San Diego or California have autism? Where will the concern be?
You know, I'm concerned and I know you're concerned. We hope
We
these
haven't we
interviews,
haven't
yeah,
moved the needle. I've been
yeah,
saying the same thing for 10 years. You may have been saying similar things. I can't say for how long, but it's not a message the public wants to accept. And it's not just the public that wants to be sanguine about these findings. It's that there's a significant part of the uh, professional community uh, who want to interpret higher rates of autism as better awareness or relabeling of autism. These are detriments to true understanding. And as long as that group carries the media attention, we're doing the right thing, but we're not effective in promoting change.
keep going. Because behind every label person is an individual that needs our support. So thank
Yes,
you.
but many people need a lot more than others. I know it's a world of limited resources, and we would want to provide the greatest resources as early as possible to those with the greatest need. Mm,
Right. Well, thank you. Again, sobering and should be for cause for alarm. Moving forward, a few questions moving forward, left in our time today is when is the next prevalence survey plan for release?
yes, I would predict that the next report, which will be on study year 2024, the activities needed to collect that information are ongoing now. We're implementing our surveillance activities in New Jersey. We have been doing it since January. The other states are doing that the same. It'll take us approximately a year and a half to complete all our work, collate it, and interpret it. And then uh, I would say another 6 months for the writing and the clearance through CDC. So I predict the next report will come out in March or April 2027. There may be interim reports along the way. Sometimes states report on special groups or special initiatives, or there may be approaches which use available data to create new information, but the next real atom prevalence estimate will be in a little bit less than 2 years.
Thank you. Given we've seen a lot of autism in the press, and I'm grateful that autism is so much in the press since the press conference on April 17th. What are the federal initiatives happening for autism right now?
I don't know what the federal initiatives are. A lot of people have asked me that, but while I was a participant in the news conference and I thought good information came forward from that, I have no subsequent information about the specific development of what experiments or what approaches will be useful, or whether there'll be epidemiologic or registry-based activities going forward. So your guess is as good as mine, possibly, as to what will be forthcoming. Um, what I do sense, however, having no specifics, is that there's a level of commitment from HHS and to some extent from the CDC as well, which will make it more likely that novel or uh, productive research will be uh, highlighted and pushed forward quickly. I think one can, I'm let everyone judge from their perspective whether the last 20 years have been productive in terms of research that makes autism more understandable or predictable. But I do sense that there's a greater sense of urgency from the federal authorities than before. I hope that that greater sense of urgency uh, is associated with high quality and novel research and fact finding.
And support for families, individuals
Yes,
post.
and
Yeah.
most important, whether one understands that there's a true increase or that it's just better awareness, the fact of the matter is 3 to 5% of families of children are dealing with autism, and there are not sufficient resources anywhere to to provide comprehensive interventions and follow through. This must be part of every conversation. Not only is it important to identify risk factors and to promote early detection, we have to do a lot of things to strengthen the ability of families uh, to help guide the interventions that their children need. This is very important and very complex, maybe as complex as understanding the risks or the etiology of autism. The the need for resources is now, and it's just going to increase.
I was going to ask, where do we go from here? But you kind of hit it. Is there anything else you would like to add? And in a perfect world, if you could architect a solution for the next steps in the autism community, what would you suggest?
Yes, I would pick out a couple of key areas for dramatic uh, consideration. Autism gene environment risk factors, which make for the increase in autism prevalence, factors which are affecting minority and low income communities more than others, uh, identifying the extent to which uh, there are not only identifiable but preventable risk factors. If there are environmental triggers for autism, we might be in a position to avoid or to minimize some of them. And those would have an effect not only on prevalence estimates, that's just a count, but would have an important effect on the lives of many families. Um, and as you mentioned earlier, our group is uh, very involved in promoting early identification and early diagnosis of autism. We do it in New Jersey through a program we call Detection Plus Connection, but the group in California, which identified high rates in San Diego, have their own specific approach. And I would learn from this approach because it's clear that not only are they identifying a large number of children with autism, but they're diagnosing them and providing interventions earlier. Should be one of the main practical public health actions to come from the report, that there are ways in which you can identify earlier and provide more resources. I hope we can continue monitoring all the states that are involved in autism surveillance to see whether in the midterm, whether some of these children who've achieved or gotten early interventions, whether this translates into better outcomes and better functional ability.
I would love to see that too. If we could get every kid diagnosed, we know we can do it before the age of 2. Why not intervene then and change the trajectory for a healthy baby, regular ed outcome? That would be fabulous.
That would make a big difference in my opinion.
Yeah, same.
These
I'm
are
hoping.
complicated questions, though, and they involve not only what researchers think and want, but what school systems believe and what they can provide. Autism is a very complex and mm, multidimensional problem. It requires complex answers and funding. None of the answers which we're likely to come up with are associated with fewer resources or less spending, but I would prefer to know earlier and spend earlier and have better outcomes for the individual, his or her family, and for society.
Agreed. I think if we could lead to a healthy baby model where we have kids that are healthy and then they can live independent lives, we have a much better society who can move things forward rather than have kids who have significant needs. So I can't thank you enough for the work that you do and your team. So please send our regards and thank you for continuing to meet with us and talk about these important data points. Is there anything I missed that you want to elaborate on before we leave?
I think we touched on all the high
All
points.
right. Well, thank you for always saying yes, and thank you for the incredible amount of work. And if there's ever any time you want to come back and talk more, we would love to do that.
Thank you so much. I love to speak to your audience, and as soon as we know something more than we do now, I'd love to come back.
Well, I look forward to that call when you have it, Walter. So again, thank you, and thank you everyone
Keep,
for listening.
keep going. Keep going.
We will. Thank you.